Thank you, and thank you for the opportunity to be with you today. My name is Dave Zynn, and I'm the president and CEO of Infectious Disease Connect, and we are a tele-infectious disease company serving hospitals across the world. Infectious Disease Connect is a comprehensive infectious disease solutions company offering consulting services, both patient care, antimicrobial and infection prevention and control consulting. And we have two software solutions, which we'll talk about in a few moments: a Lumiform, which is a guidance app, and a Loom Insight, which is a platform for antimicrobial stewardship. ID Connect is a UPMC offshoot or a rollout after years of working telemedicine services inside the infectious disease department at UPMC. We commercialized Infectious Disease Connect and are now taking our solutions to hospitals outside of UPMC. And in March of 2020, we acquired a Loom Health and its software and solutions from Merck. And we are now uniquely positioned to be both a services and a software solution. So again, our services are very comprehensive. We have tele-ID consultations. This is taking care of patient care in the inpatient setting. We also offer outpatient clinic or transitional services. We do antimicrobial consulting and infection control consulting, both tele-driven. And then we have the solutions, the software solutions, which we'll go into in more depth. What's unique is we're able to customize this solution or these groups of solutions to your specific site needs. And we can offer these services a range of full service coverage. It can be a second opinion, or it could be backfill if you just need additional infectious disease care. And as we mentioned, or as I mentioned, any of these services can be done via telehealth services or with our software as a bundle. So what differentiates us? We are a world-class ID specialist. We have the knowledge and the expertise of the UPMC division and its service providers. And we offer subspecialties such as pediatrics, orthopedic, microbial resistance, which we'll talk about in a little bit, and oncology and transplant, as well as many others. It's basically bringing a high-level academic quality care and the best practices to the local level. So we sort of invert the model of care, which used to be if you had somebody with an infectious disease, you would transfer them to a tertiary facility. What we do is we flip that and we bring the academic level quality care to your bedside. And what we hear a lot from our customers is the quality improvement that we bring to ID care across the spectrum. We deliver both clinical and financial improvements. We have tremendous feedback from our customers and our patients. We survey patients at our local hospitals. We combine the software and the clinical services, as we mentioned, and we continue to innovate and develop, which we'll talk about in a bit. ID Connect is a gold standard in telemedicine and patient care. One of the quotes that I love from one of our customer surgeons. I mentioned that we're continually developing. We like to listen to our customers. We like to solve for their problems, and that has led us to develop additional improved offerings. Pediatric tele-ID services. Pediatrics is a subspecialty, and we're combined with Children's Hospital of Pittsburgh to bring pediatric ID care to hospitals. Orthopedics also, surgeries, transplants, joint replacements often lead to tissue and joint infections, and we have some of the world-leading orthopedic associated infectious disease doctors. So we can take on patient care, or it could just be a peer review where we are working with your local ID docs to make sure that they're looking at each case or extreme cases. Outpatient antimicrobial therapy, following the patient post-transfer, if they're still on an antibiotic, into the home or the long-term care setting is an offering that we are working on as well. And microbial resistance, which at the end of the day is probably what keeps a lot of CEOs and CMOs at hospitals awake, is that in the microbial resistance or the infectious disease related to multi-drug resistant organisms. We have experts in the field, world-renowned, and we can bring that guidance. We're a SWAT team in the event that you have an outbreak. We can also come in proactively and review your policies and procedures and guidelines around the resistance or an outbreak. So again, we're constantly looking to evolve and to add to our service levels. For our technology, Lumiform is actually a new offering that we just introduced. It's a customizable antimicrobial app. We found that a lot of hospitals did not have the guidelines readily available, or still today print hard copies, which can be time consuming and lead to things being not the latest and greatest guidelines. So these are very user-friendly. They're real-time guidelines that can be updated periodically. You can communicate to your team if you update a guideline. Bug drug references are very actionable. You can save favorites. You can have dynamic search. And we've been demoing this for new customers, and we just continue to get rave reviews on not only the level of the guideline, but how user-friendly the guidelines are and the ease of use and communication. And we're developing a very similar module for infection prevention and control that will be out sometime in the fall. And then a Loom Insight software, which we purchased from Merck, is, as mentioned before, a dynamic clinical decision support tool. And it really is used primarily for antimicrobial stewardship, which is very important. Resistance and drug and antibiotic care is a worldwide issue, and COVID reminded us of that. So with using a very powerful and configurable rules engine, we take real-time feeds of patient data and create actionable alerts. And these increase target interventions by your pharmacist to the bedside, increase improvement of bug drug mismatches, de-escalation of overall usage, increase the use of oral meds versus IV. And we have seen some tremendous results from this that we'll talk about in one moment. And again, it improved clinical communications. Insight has the ability for communication between pharmacy and bedside in both directions. We did a pilot, which we've published at a local community hospital that was doing a nice job of antimicrobial stewardship. And when we came in and we turned a Loom on, we saw instant improvements. We saw a 20% decline in period over period overall antibiotic use. The duration of antibiotic use, which is at the end of the day at the heart of antimicrobial stewardship, we saw almost a full day decrease in antibiotic days. And we saw the patients being, the number of patients being on antibiotics and the length of their stay being on antibiotics decreased significantly. Tremendous increase in oral versus IV, again, safer, cheaper, and allows the patient to get home sooner. And we were able to get patients on that optimal therapy almost a full day sooner. And how we were able to do this is because of the live feeds and the real-time alerts, the improved efficiency of the pharmacist was tremendous. Again, hospital doing a nice job of antimicrobial stewardship, saw almost a 300% increase in the number of interventions with the same staff and the same time commitment. Just kind of summarizing, we can bundle these services. And again, we feel like this is very unique. There are software providers, there are service providers, but we can really bring the best of both worlds. We have tremendous software, and putting that software in the hands of our world-class specialists and varied specialists with subspecialty care is a tremendous value. And we have seen and heard from our customers the tremendous improvements that we've made in their clinical situations. And we were recognized for this. KLAS, who many of you may know, is a worldwide research firm specializing in IT healthcare, did a spotlight and interviewed our customers. And we expected to do well, but the results exceeded our expectation. with 100% approvals, A+ across all the measures, and some really great feedback. And you can see here some of the great quotes that came out of that interview process. And that class report is available on our website or through classresearch.com. So again, I think we've all seen over the last year and a half the importance of having the right policies, procedures, how global disease can be. We know that resistance is a worldwide issue. So imagine putting the right data in the right hands at the right time for the right patient every time. And that's what we do at Infectious Disease Connect. We specialize in ID care comprehensively across the entire spectrum. So thank you again for the opportunity to present, and I'll be available later for some questions.